Vaccine mandates is a topic we've returned to again and again over the past year, but now healthcare workers are facing an ultimatum: get the shot or get an exemption. And it's a question facing hundreds of Midland Memorial Hospital workers. The deadline to get vaxxed or get an exemption starts in the next couple of weeks. Rachel Robinson has more on how the hospital is handling that deadline and how it could impact their already decreasing staff numbers. Rachel.
Yeah, Crystal, this all changed last week. The Supreme Court got rid of the OSHA mandate, but upheld the Centers for Medicare and Medicaid vaccine mandate. So that means that people that aren't vaccinated either have to get vaccinated or they can file for an exemption. February 14th is the deadline for healthcare workers at the hospital to get their first dose of a vaccine or to have an exemption approved.
We have a total of around 200 employees that are not vaccinated and to this point have not submitted an exemption, medical or religious. We hope to see some movement on that in the next few weeks.
The message from the hospital comes from a Supreme Court ruling that the Centers for Medicare and Medicaid are allowed to require vaccinations for the hospitals that they support. If staff doesn't comply, there will be consequences.
If by February 14th, we do not have either your first round vaccine documentation or an exemption, you will be placed on unpaid leave for up to 30 days.
And there are two types of exemptions that staff can receive: medical, which is very strict and must adhere to CDC guidelines, or a religious exemption, which is less strict.
On the religious exemption, it's very broad. There is a form that the employees have to fill out. I think we've approved over 200 to this point, religious exemptions.
After employees fill out a form for religious exemptions, it goes before a committee to approve or deny. Political views do not count as a religious exemption.
Responses in the exemption request that speak just to purely political reasons, for example, I don't think the government should impose this upon me. Those are things that the guidance that we're seeing and are bound by say that we cannot grant an exemption on those purely political reasons.
The reinstatement of the vaccine requirement has some of the local health leaders concerned.
So we are very concerned about losing staff, and that's why we're trying to work with our workforce to allow them to qualify for the exemptions, medical or religious, if that's what it is. And following the letter of the law, we certainly want to comply with the mandate. There are serious consequences to the hospital if we don't.
And another important day for hospital workers to keep in mind is March 14th. That's when they either have to have a second dose of Pfizer or Moderna, or they could qualify for unpaid leave. In Midland, I'm Rachel Robinson.